Cardiovascular health is gonna really be highly predicated on the diet and exercise. Those are gonna be the top two things that are gonna play the largest roles in determining cardiovascular health. The diet is extremely important because there's a lot of different factors that are going to go into some of your risk assessment. The amount of cholesterol in the diet, which is coming from fat, is going to be important to some extent. In and of itself, cholesterol isn't dangerous as far as the heart is concerned. It's only when that cholesterol becomes inflamed or there's a lot of oxidative stress or inflammation in the system that it becomes more dangerous. Because as that cholesterol is circulating through the bloodstream, if there's any inflammation around, it's essentially going to start hardening and it's going to start creating plaques in the arteries. That's when we get into atherosclerosis or hardening of the arteries over time. That's when we can potentially have some disruption of that plaquing to create clots that give us either heart attack or stroke, or narrowing of the arteries to such an extent that no blood is able to pass through effectively. You get some kind of ischemia or decreased blood flow to certain areas of the body. It's really the inflammation sits on top of that cholesterol level. So if you have high cholesterol and you are eating poorly, not exercising, that increases your risk exponentially. If you're eating a high fat intake diet, but you're avoiding sugar sources, you're exercising, you're detoxifying, you're hydrating, that decreases the risk of that high cholesterol quite a bit. And that's one of the most important things that people can do, is really just making sure their sugar load is relatively low. So a lot of these high carb foods, lots and lots of breads, white potatoes, pastas, too much rice, all of these sugars are going to be somewhat inflammatory if they're eaten in really high loads, especially if you're combining that with high cholesterol, whether that's familial or genetic, or acquired from any kind of dietary approach. That's really going to kind of stack on top of each other. Then exercise is the other really important part here, because as we exercise, our heart is strengthening as well. Your heart has muscle tissue, it has electrical conductance. So as we strengthen our bodies through exercise, you're getting your heart to contract more forcefully and less quickly. So it becomes a lot more efficient. If you're doing cardiovascular activity, especially, over time, you actually get a larger volume in your heart chambers to pump even more blood with each contraction. So the heart becomes more effective over time. So just trying to exercise, even if you're talking about, going for a 45-minute walk every day, at least you're getting the circulation going, you're moving, heart rate's starting to come up a little bit, you're getting some exercise in. As far as diet, again, really trying to stick with a lot of vegetables. That should be the majority of what's coming into the diet, so we can keep the sugar levels down, keep the inflammation low. And then when it comes to supplementation, there's quite a bit we can do there as well, just to decrease inflammation, potentially even to alter contractile force of the heart, try to help with circulation. And there's a lot of different approaches we can do to help supplement the diet and the lifestyle choices here to really optimize heart health. But the big thing to keep in mind is that almost all of cardiovascular health is up to the individual. Genetics play a very, very small role. Most of it is epigenetic. It's going to be what you do throughout the course of your day-to-day life that's going to really determine how your cardiovascular health is going to change over time.